I have to tell you that from back in the 1960s, when the medical genetics course was founded here at Einstein, there's always been this session. That is, at the end of the genetics course, and more recently, the Molecular and Cellular Foundations in Medicine course, the last session of the course has always been turned over to the clinical geneticists to interview a patient. And the reason for this is to let you know, to get you to understand that the concepts that you've learned through these months have founding in human medicine. The fact is that behind all of the science that you've learned are patients. And you need to carry that with you throughout the rest of medical school. So this is the first time, though, that we've had an actual celebrity patient who has spoken to the group. And so with that, I'd like to introduce Miss Debbie Jorde, who has come from Salt Lake City to speak with us today.
Thank you. I'm very happy to be here. One of the reasons I'm here is because I've spoken to the medical students at the University of Utah each year in their first year of medical school in their human genetic course. Usually Heather and Logan are able to attend with me, which I would have loved to have them be here so that you could meet them, and they would love to be here as well. But because of the PCD, they're very susceptible to getting infections, and traveling on a plane in flu season would be very risky for them. So they're sad to miss this opportunity. Medical students have told us that our presentation has made a really big difference for them because it touches their heart, and they feel like it helps them be a better doctor. So thank you.
I should also start off by telling you that that all of the story of Debbie and her two kids are covered in this book, which she's written, called 8 Fingers and 8 Toes. I read it. I had the opportunity to read it, and it's really wonderful. So just to let you know that.
Thank you.
I feel like a talk show host. Anyway. So I'm just, before we actually start, do you have a response to seeing the baby pictures of Heather and Logan that Dr. Spiegel showed?
I really enjoy seeing their baby pictures because I think all parents face that as their kids grow up. Even though they still have their kids, they're different people. And when I see them smiling on the beach there, it brings back some really positive memories. Whereas once they became adults and had to face a lot of the challenges of adulthood and a lot of their limitations, things they want to do that they're not able to do, there were fewer smiles. So.
I actually have never met Heather and Logan, but I know them. And the reason I know them is those pictures, the original baby pictures, the ones that were in Journal of Pediatrics, are in a book called Smith's Recognizable Patterns of Human Malformations. And as a clinical geneticist, when I started out, when I was a medical student and a resident, I used to keep the book on my, I know this sounds really weird, but I kept it on my nightstand, and every night I would turn a couple of pages and look at the different pictures and the different syndromes. And so from early on, I came to know Heather and Logan without actually knowing who they were, because Miller syndrome is one of the entries in the book. So it's wonderful to actually meet them. I think that the an important message for you guys to hear is that genetic disorders are not diseases that affect just the child, but they have a much more far-reaching effect. And so I wanted to take Miss Jorde through really her life from the time that she first had Heather. So can you tell us what your life was before Heather was born?
Well, I was an active teenager in school sports, gymnast, track and field, healthy, strong. I don't know why I volunteered to give a talk in 9th grade graduation, but I did, and my voice was shaking so much, my friends asked me if I was crying. And then in high school, they made an announcement about running for student body office, and I just looked at my girlfriend and said, hey, should we do it? So I didn't know myself very well, but I obviously was attracted to stimulation, which is why I'm here now. It's very stimulating being in front of a group of medical students speaking. So basically, I was healthy, I was strong. I was raised Mormon, being in Salt Lake City, Utah. I'm not Mormon now, but I was raised to be a wife and a mother. That's basically what my life's goal was. So I knew I was going to have children. Heather and Logan's father was he was an athlete as well, basketball player, voted the most likely to succeed in high school. 2 very active, strong, healthy adults that we got married when I was about 20.
So your life, the life that you were looking at that point is you're married, you're going to have children, probably lots of children, and be a mother.
Right, just a normal life. You know, you have children, then you have grandchildren, and the white picket fence, and the house.
What did your husband?
American dream.
What did your husband do? The American dream, exactly. What did your husband do?
Actually, he was a salesperson and ended up doing accounting.
So you, if I remember the story correctly, you were living in an apartment and ultimately bought a house?
Yes.
Yes.
I went to barber school, so I got my license to do hair, and then we were living in an apartment when Heather was born, and later moved to a home.
Right. So how old were you when Heather was born?
I was 21.
So they're going to do the math. I don't know that.
I'm 55. I just had my double nickel birthday, January 31st, and Heather will be 34 next week.
So you're pregnant, you're looking toward the future. During the pregnancy, was there any indication that there was any problem?
No reason to think there would be any problems. You know, I think like most people newly pregnant, you think, gee, what if something's wrong with my baby? And I thought, look at all the normal babies born every day. Of course there's nothing wrong with your baby. And I never thought about it again. I had a lot of motion sickness. I don't know why they call it motion sickness. It was pretty much 24/7. And I was pregnant for 10 months. Every Friday I'd go to the doctor and he'd say, see you next Friday. And I was just mad because I didn't want to be pregnant anymore. And I'd go and he'd say, see you next Friday. I just hated him for that. Finally, a month later, I went to the doctor and he said, I don't think I'll see you next Friday. So we started driving to the hospital, and suddenly I thought, I can't back out of this.
That's right.
There's no turning back. I can't change my mind, and I just felt trapped, like a claustrophobic feeling. We got to the hospital, and the nice nurses and doctors calmed me down and reassured me that things would be just fine. So they were wheeling me into the delivery room, and I saw a pile of pink and blue blankets and thought, oh yeah, I wonder if this baby's going to be a boy or a girl.
So you had no indication?
No, we didn't do ultrasounds routinely back then, so I didn't even know the sex of the baby yet. So
it was a complete surprise.
Complete surprise.
So Heather is delivered. We don't have to go through the gory details of the delivery. And what happened in the delivery room after she came out?
Basically, they pulled Heather out of my body, and the doctor said, you have a girl. And he placed her on my abdomen, and my eyes locked onto her bent arms, which you saw in the slides. And my mind started racing, thinking, her arms are bent. Denial set right in. No, they're not bent. Yes, they're bent. No, they're not. After she's been outside me for a while, they'll just straighten out. They're not really bent. And then I heard Heather's dad say, something's wrong with her arms. And then I couldn't deny it. So I very timidly said to the doctor, is everything else okay besides her arms? And the doctor said, I'm sorry, Debbie. She only has 8 fingers and 8 toes. And it seemed unbelievable because when I was pregnant, people would say to Terry, what do you want, a boy or a girl? And he'd say, I don't care, as long as it has 10 fingers and 10 toes. So I stayed in denial because that was the safest place I could be right then. I don't want this baby. This didn't happen.
Did the people in the delivery room or in the recovery room afterwards react to you differently than they did before you delivered the baby?
I was so in my own head. My doctor was wonderful. He just looked at me and said, I'm so sorry, this isn't the kind of baby I anticipated for you. But I really didn't notice how anybody else acted.
So you were really in denial and a little bit in shock about what had happened. In the days following the delivery, what other problems were identified? Did you realize were going to be big problems in your life?
Well, by the time I got back to my room, the pediatrician came in and told me that Heather had a cleft palate. And I was really disappointed because I wanted to nurse. Partly because I know mother's milk's good for the baby, and partly because my sister's weight just fell off when she nursed. And I wanted that to happen to me too. And he said he didn't know if she could hear because her ear canals were so tiny they couldn't look in there and see eardrums. And they didn't know if she could see because something was wrong with her eyes, but they were still swollen from birth.
So they knew there were multiple problems, but they didn't know what this was.
That's right. That's right. They didn't know what it was. They said, we think it might be Treacher-Collins.
Right.
So that affects the facial features.
Right. So Treacher-Collins is a condition in which the maxillary region and the mandibular region don't form properly. And the facial appearance is very similar to the facial appearance in Miller syndrome. But the difference is that in Treacher-Collins syndrome, the limbs are not affected. In fact, nothing below the neck is really affected in Treacher-Collins syndrome. So that was the closest thing they could come to on the basis of it, but they didn't know what this was.
That's right. They didn't know what it was, and we had to basically wait and see. We had to wait and see, and Heather did have trouble breathing, so she had to stay in intensive care for 2 weeks. And I couldn't take her home if she couldn't eat. So I learned how to tube feed Heather. But a kind nurse brought in a big long lamb's nipple. It's about 3 inches long. We cut a big hole in it. It looked like a turkey baster. So we would just squeeze the end and the milk would shoot down her throat and she'd suck on the lamb's nipple.
The problem is that in order to suck from a bottle, you have to, or from a nipple, you have to be able to generate enough negative pressure to draw the fluid through the nipple into your mouth. If you have a hole in the roof of your mouth, you can't close off the roof of your mouth and generate that negative pressure. So it's often difficult. But because she was able to swallow like other kids, if you just make it easier for the fluid to spill into her mouth, she should be able to handle it. And that's really kind of the concept behind the lamb's nipple. So how long did she stay in the hospital?
She was in the hospital for 2 weeks in intensive care.
And you went home before that?
I went home because I couldn't see any point staying in the hospital when my baby wasn't in the hospital with me. And while she was still in the hospital and while I was still in denial, I had all my phone calls stopped because I didn't want to hear people say, I'm so sorry. Because if I heard that, I would have to admit that something really sad was happening and I wasn't ready. But later that day, I slipped my slippers on and walked down to the nursery. And I looked at Heather in the nursery, and she was in there all alone. And I thought, All the other babies are with their mother. But this little baby's all alone because her mother doesn't want her, and I'm the mother. And with tears falling down my cheeks, a nice nurse came over and put her arm around me and had me go back and watch them feed Heather and hold Heather, which helped me bond.
Mm-hmm.
So then when she was moved to Primary Children's Hospital because of a heart murmur, and the doctors asked me to sign release so she could go have a heart catheter, and they also asked me to sign a release for them to do an autopsy, because obviously she had so many problems, they didn't expect her to live.
Right. So what are you thinking at this point?
I actually started to think, well, maybe it's a good thing. Maybe it's a good thing that she's not going to live. Then she won't have to live with all these problems, and I wouldn't know how to be a mother to her anyway. So I actually accepted that idea.
Mm-hmm.
So when the doctor came back in person versus a phone call, which really touched me, he said, if I'd have known her heart looked that good, I wouldn't have done anything.
Mm.
And for one split second, I felt disappointed because I was back to looking at the unknowns.
Right. It was kind of a way out that
Yeah.
would have been kind of painless for everyone involved, but it would have meant the loss of the child.
Yeah.
Yeah. There's something that we, as clinical geneticists, debate all the time, and I just wonder about your feelings about this. We don't know what to say to parents when we first meet them in the nursery when a baby is born with birth defects. So should we come in and say congratulations and here, on having this baby, here are the problems that we found? Or is congratulations something you don't want to hear from a doctor who's coming to tell you that there's something wrong with your
Should
baby?
I tell them what the doctor said
Yes,
after
absolutely.
Logan was born?
Yeah, well, yes, definitely.
He came in and slapped me on the leg, and he said, congratulations, you just made medical history. And I really didn't take offense to that. I was kind of slow at taking offense to things. It wasn't until I saw people's reactions later that I realized it probably wasn't a very sensitive thing to say. But, I just think I didn't want to hear the words, I'm sorry, but the first thing I want to do to people is say, I'm sorry when something happens. I think the most important thing is just say, I care about you and I'm thinking about you.
It's very important.
And if there's I want to do everything I can to help you through this.
And what can I do to help you? I think
Yes.
that's something that I think young doctors should hear all the time.
Mm-hmm.
And a lot of times there's not anything we can do. There are some conditions that are just, there's no treatment for it. There's nothing we can do to fix it. But we can be there for you and hold your hand and get you through what's happening. Because, as I said before, the birth of a child with a genetic disorder is not something that affects just the child, but the mother is the patient, the father is the patient, the extended family is the patient. And everybody has their needs, and everybody has to have those needs met. So that's important, I think, to hear and understand. So Heather is in the hospital for a couple of weeks. You're passing a gastrostomy tube, an NG tube, a nasogastric tube, in order to feed her.
I actually only had to learn how to do that once I got her home. Basically, I spent most of the hours of each day feeding Heather with the lamb's nipple and watching soap operas.
Right.
And going to doctor appointments.
All over the place, right? Because
Yeah.
there were so many different
Together,
doctors.
Heather and Logan have had between 40 and 50 surgeries. And they need more. But they know so much now. They know how much pain there is. They know that surgeries aren't perfect. They're afraid of, they're familiar with the differences they have now. They're afraid of having other differences. Having more eyelid surgery means you're going to look a different way. What if it's worse? When Heather had her cleft palate repaired, it was a great success, and Logan's as well. But then later, when they had to do that surgery, you saw they had to move Heather's upper jaw forward and her lower jaw back. And we thought it important to do that because it was affecting her speech. But afterwards, she couldn't speak. Even if your jaws are wired shut, you can speak. Heather couldn't speak, and we were completely confused by that. And when I saw her fluids start to run out of her nose, I became very suspicious. So I asked the doctor, why can't she speak? And he said, oh, I had to undo the pharyngeal flap, which corrected her cleft palate, in order to move her upper jaw forward. Now, obviously we would have still done the surgery, but we thought this was going to be the last surgery for a while. We would have, that's an important thing to have known. Mm-hmm. And I wouldn't have known to ask him if he's going to undo that because I'm not a doctor and I don't know what the steps of the procedure are. So that was really tough.
So you have to inform the family of all of the things that
I know it's hard, and as doctors you have limited time when you're with your patient in the room and you have other patients waiting, but your patients don't know enough to ask you all the questions. Mm-hmm. So what we appreciate is if a doctor will try and answer as many of the obvious questions that other patients have asked, mm-hmm. and just volunteer the information. And of course, nowadays we have internet, so patients can be actually a lot more prepared to ask you questions than I was back then.
Which is a good thing.
A good thing.
Absolutely. So after Heather's birth, they still didn't have an explanation for what the problem was. When did she actually first get diagnosed?
When Heather was 1.5 years old, the geneticist called me up and he said, I don't think she's Treacher Collins. We think that she's got postaxial acrofacial dysostosis. And at that time, I remember him saying there were only 3 cases in medical history. And he said that it would not happen again. He said it was a chain mutation. For some reason, when the cells were dividing, they just started this way, and this is what we ended up with. In fact, the chances of you having this happen again are probably even less than the average person because it already happened.
Like lightning striking.
Yeah.
Yeah. Right.
Yeah.
That's an expression we like to use
mm-hmm.
all the time. So that was
green light.
Yeah.
I wanted another baby.
What was your husband? How did your husband respond to Heather?
Terry was a wonderful dad and loving and protective, but he didn't want another child. He always feared that there was something wrong with him, and that's why Heather had the problems that she had. He was more experimental with marijuana, and I'm not sure what else. So he was worried that maybe he was just messed up. Mm-hmm. He didn't really want another child, but if I wanted one, he went along with it. So,
I meant to ask. Guilt is almost every mother I've spoken with has harbored some guilt when I ask her what she thinks caused the baby's problem. She'll frequently say, "Oh, it was something I took during the pregnancy, or it was, the job that I had. I was exposed to some gas during the pregnancy that caused it." Did you have those feelings?
I am so happy to say, for some reason, I was spared the guilt trip. I did not have any guilt. I never felt like I was being punished. I did wonder why it happened, though, and I remember going to the bishop of my ward, which is a small, the church, they're all divided into wards, neighborhoods, basically. And I said, why does this happen? And he had me read the book, Why Good Things Happen to Bad People, or something like that.
Yes, that's
Why
it.
Good Things Happen to Good People,
why
even.
Bad things
Why
happen
Bad Things
to
Happen to Good People. That's
Written
it.
by Harold Kushner, who had a child with progeria, an
Okay.
autosomal recessive disorder, the genetic basis of which was discovered by
Francis takes credit for everything.
everything.
He's a co-author.
Yes.
So one thing that actually helped was that as a Mormon, I was taught that I was special to be given a child with problems. However, when I read that book, suddenly I realized I wasn't special because this happened. It just happens. It doesn't matter if you're good or if you're bad. bad things happen, good things happen, and all of a sudden, I was back to, it just happens. So I decided I wanted to have another child, and I decided I wanted a boy, because I decided a boy would be better for Heather, because she wouldn't have a beautiful, normal little sister that could participate in all the things that she couldn't participate in. And so I found a magazine that told me all the steps to follow to have a boy.
Well,
so I followed the steps, and I guess it must have worked. I got a boy. First I had a 50-50 chance.
You got pregnant again. Terry is kind of with the program, but not...
He's going along with the program,
but not enthusiastic.
That's right.
And again, did you have any special testing during this pregnancy?
I decided I didn't want the shock in the delivery room, just in case. Even though I had the kind of faith that I was taught in my religion that could move mountains, that nothing would be wrong with my baby. I had faith, in my opinion, the strongest faith a human being was capable of having. So I decided to have an ultrasound done at 7 months. And in my ultrasound, they told me that I would have a healthy, normal girl.
They were completely wrong.
Completely wrong.
So much for sonography.
That's right.
So it was a complete surprise when Logan was born, and not only was he a boy, but he was also affected.
When Logan came out, I cannot tell you how unbelievable. Seriously, you saw how bent the arms are. There's no mistaking those arms. So they pull Logan out of my body, and immediately we see those arms. And Logan's dad said, "Son of a..." And it was just, it was a different kind of shock than when Heather was born. Because Heather was now 3. And I loved her with all my heart, and I was familiar with the challenges. It was just shocking. And of course, I was worried about nursing again, and I'd made a great big cape, and I'd embroidered a sign on it that said, "Out to lunch." And I was going to nurse Logan in public, because what's the point of nursing if it can't be convenient? So I said, "Does he have a cleft palate too?" And the doctor said, "Yeah, he has a cleft palate too." So all the same symptoms as Heather, including he was having trouble breathing. Mm-hmm. So he was staying in the hospital for 2 weeks as well.
Right. And so what is going through your mind at this point? You've been hit by lightning twice.
Oh, also, Logan was born on April Fool's Day. So when I called my friends, I actually wanted to call my friends so they wouldn't hear about it through the grapevine, because I wanted to spare them the shock if I could. So I said, "I had my baby. It's a boy. And he's just like Heather, except he has red hair." Silence. And then she said, "April Fools." I said, "No, really. He's just like Heather." I said, "But don't worry, I'll be okay." And that's how I broke him in.
So it was a little easier at this point in telling people and in coming to grips with it. You're kind of an expert at taking care of kids, probably the world's leading expert at taking care of kids with Miller syndrome.
Miller syndrome.
Yeah. So that's an important thing. Do you think now, looking back in retrospect, was it easier for Heather and Logan to have each other than it would have been had there just been one kid who was affected and one kid who wasn't?
No doubt about it. You know, we all like to belong to some kind of group, so we can feel like we belong, especially when you're kids. And Heather and Logan had each other. They weren't the only one in their world that looked the way they look,
right,
and that have their challenges.
But they were the only 2 in Salt Lake City who looked the way that they do.
Yeah, and we knew that they were the only 2 out of the only 3 that we knew of in the world that looked the way they do. So
you've met other kids with Miller syndrome?
There was a mother who had a child in Chicago who's in her 20s now, the child is, and she started the Foundation for Nagar and Miller syndrome. And their goal is to raise enough money to get these kids together from all over the world. To my understanding, there's approximately 30 that are documented in the world's medical literature.
Nager syndrome is like Miller syndrome, except instead of involving the outside of the hand, it involves the radius side of the hand. So not the ulnar side, but the radius. There are radial ray abnormalities associated with it. And so when you go out in the street, I mean, the kids were going to doctor's appointments all the time. They must have spent half of their life in the hospital or visiting hospitals. What's the kind of reaction that they get when they went out when they were younger?
Well, as all of you can predict, I'm sure, there's a lot of staring. I think human beings are a lot like cats. They're naturally curious, and people are naturally curious. And even when they try not to stare, they have a hard time not wanting to. And I'm actually a human being too that likes to look at something curious. So you'd think that because I have two children that look different, I wouldn't be curious about looking, but I'm just as curious as you are. And I'm going to try not to be conspicuous about it, but it is a curiosity. And so people do stare. And Heather, we didn't know that she was on the autism spectrum back then, but about 6 years ago she was diagnosed with high-functioning autism. So she lived in a little protective bubble. Heather didn't notice that kids were staring or people were staring. In fact, this was hard to imagine, but it wasn't until Heather was 18 and she got on the internet and started connecting with people and they started communicating their innermost thoughts that she realized people are going to judge us because we look different. And she went to a school event in the auditorium, 18 years old, the first time she ever noticed that no one sat by her in 18 years. And that was because she was protected from the autism. Logan, on the other hand, even though he was also diagnosed on the autism spectrum, is a lot more social. He's less affected socially. He knew from an early age and hated it. He hated looking different. Logan lived his life so much in denial, but we didn't know it till his 20s. He literally thought he was normal. That's how strong his denial was. He observed people the way someone with OCD or autism would focus on how people did things, and he tried to do everything the way normal people did things, how they picked up their drink, how they scooted away from the table, how they carried themselves. And in doing that, he's actually caused himself a lot more chronic pain and a lot more problems. And his bubble did burst when he was 20, and he could no longer live in denial. He even tried marijuana and alcohol to help him stay in denial. Eventually, those things don't work. You have to face reality, or you end up with a lot of psychological problems. So at 30 years old, Logan still struggles with reality, finding out, well, if I do this, it'll hurt my back, and I'm taking morphine for pain. Do I really want to hurt my back? But I don't want to admit I can't do it. He's an artist. Does he want to admit he can't paint? Well, who would I be if I wasn't an artist? So and Logan does struggle with going out in public. He's basically that he blocks it out. He just walks in and he just blocks out people's reactions.
Mm-hmm. You said before that actually it was Heather who made the diagnosis of autism in herself.
Yes, Heather has a degree in psychology from the University of Utah, and she knew she was different, but it was separate from Miller syndrome and something's going on with the lungs. So she started to research, and she loves to read stories, and she got on a trail of autism, and she read more and more, and she emailed a doctor who wrote a book about it, it's a great book. The title's great. It's like you thinking about me thinking about you. And Heather diagnosed herself with autism. So when I was writing my book and I suggested that she had autism, she said, don't you think I should get a professional diagnosis if you're going to mention it in your book? So I did. And she was diagnosed with high-functioning autism. And then later Logan was diagnosed pervasive developmental disorder not otherwise specified, PDD-NOS. He's so funny. I wish he could be here and tell you guys that, because he'll go. He couldn't remember the whole thing. He goes, yeah, I'm not otherwise specified. He has a great sense of humor.
But PDD-NOS is on the autism spectrum.
Yes,
also.
that's right. In fact, they're changing the name, I heard. Have you heard that? It's going to be called the Autism Spectrum Disorder, ASD. So there won't be any more PDD-NOS or...
Right. Right,
Okay.
and actually, I think it's going to be changed to autism spectrum condition.
Oh,
Because
okay.
disorder has a negative
Okay.
connotation. Anyway,
Okay.
so the kids both have respiratory problems.
Yes.
And what kind of other problems do they have?
Well, the biggest problem besides their lung disease is what threatens their life. Heather almost died 2 years ago from pneumonia. And I've always lived with, I don't know how long they'll live. I've never known how long they'll live. So the biggest problem, which I have to say it was enlightening for me, I had an editor read my book and she said, I'm left with questions wondering, how does Miller syndrome affect our life every day? And I thought, oh, I guess because I live with it, I didn't get specific enough. So I followed him around with a tape recorder and I asked him how they did things. So Heather and Logan had their wrists straightened out. So instead of having their hand bent down 90 degrees, they have absolutely zero wrist rotation. It's hard to imagine no wrist rotation. And
Especially for an artist.
especially for an artist. And Heather has one elbow that won't bend further than this. She literally, her forearm is so short on one arm, and her other arm, her elbow doesn't, she can't reach her neck. If she gets an itch, she has to grab a fork or a pencil to scratch her neck. And so I described this in the book, like for Heather to shampoo her hair, their fingers are bent all the time. They do everything with their pincer movement. I asked Heather to squeeze a piece of paper as tight as she could, and I could just pull the paper right out of her grip. So even with a pincer grip, it's not very strong. So imagine going around your whole day and having to do everything, make your bed, eat, shower, and we have long forearms and wrist rotation. So take away your wrist rotation and do that. So when Logan paints, both of them, they have to lift from their shoulder to do and if they need to twist the brush, he has to twist his shoulder, which stresses his back, and they both have some scoliosis. Logan has joints that are fused that shouldn't be, and joints that shouldn't be that are. So he's on morphine 3 times a day for chronic pain. And I'm happy to say he still wants to be alive. Mm-hmm. They struggle every single day, and it was such a great addition to the book because a lot of the stories in the book are things that all of us could be doing, going to college or, but then you remember what you read about the description of what they can and can't do. And suddenly it means a lot more. They both drive, they live in their own apartments. Logan, I worked real hard with the government and got funding for his art business. His stick shift is lengthened, he has at least resistive steering, his steering column is extended. They're as tall as I am, they're both 6 feet tall. With these short arms, they're very close to the steering. But with all that.
So even though there are these many disabilities, orthopedic, respiratory, they're essentially living normal lives.
Well, I don't know if I'd say normal, but they are in the fact that they're in their own apartments, mm-hmm. They drive their cars, they do their grocery shopping, they're independent, they're dependent in some aspects and independent in others.
And leading productive.
Heather has a boyfriend. He didn't know it either, but he's also on the autism spectrum. He's in his 50s. He's considered her, basically her helper to help her live, her physician's assistant kind of thing. And Logan has a dog. So they're very independent considering all of these disabilities.
There's so many things I want to ask you, but I think we're running out of time. So I want to just move to another topic, which is, so growing up, they had Miller syndrome, but there was no explanation for why this happened. Could it have been a teratogen that they were exposed to in the womb? Could it be just a chance mutation that both of them had? Could it be a genetic disorder that is autosomal recessive? So this was a question that you guys were, and what's the respiratory part of this? How does that fit in? So how did this get resolved? Mm-hmm.
So we had to tell people we don't know, and that was really hard. And it was hard not knowing. And basically we would say what it said in that paper that you saw, which is our best guess is that it's recessive. So that's pretty much what I would say, our best guess. So when we were asked if we were willing to participate in the study to have our entire genome sequenced, we enthusiastically responded yes. And we were really excited for them to find out other stuff too, which now that we realize what they were looking at and how hard it would be to specifically look for other things, they were just looking for this. So when we were told that Miller syndrome is caused by a gene, I was actually surprised when my eyes filled with tears of happiness.
Because you finally had an answer.
Finally had an answer. 33 years.
And the primary ciliary dyskinesia.
That was a shocker. Primary ciliary dyskinesia. Heather is a researcher. She loves to research. She had much more problem not knowing what was threatening her life than she did not knowing what caused Miller syndrome. When she found that out, she was so happy. And even though it doesn't change her treatment, they're being treated at the cystic fibrosis clinic. They have to work on airway clearance. They both feel like their life is so challenged. Doing airway clearance 2 to 4 times a day actually would make life not worth living in their eyes. So they do their airway clearance when they get sick. But Heather was so happy to find that out, and Logan as well, and at least we know we have answers.
So I'm sorry I cut you off, but so just having an answer, even though the answer is something that there's nothing we can do anything about, but just having the answer is enough. Is that right?
Just having the answer is huge. When you think about if you don't have answers to something, how much you want an answer, you just want an answer. You just want to know why. And that's what we wanted, was an answer. And it was wonderful. It tied up loose ends. And it also was wonderful to know that we were able to contribute to something that will give other people answers. Because we know what it's like to live without answers. So we're really happy that other people, and for Heather, she said it so well. And if you guys tune in to get online after this and go to KSL Channel 5 News, we were on the news a couple nights ago. You can see Heather and Logan, and it focuses
I think it's a good idea.
them.
We can send everybody the link.
Yeah, great idea. So Heather said that because she didn't belong to the cystic fibrosis group, and she didn't belong to the Treacher Collins group, and she didn't belong to any really group, she actually felt like she didn't belong to mankind, like she was isolated her whole life. Suddenly, she felt like she belonged to mankind, because now we know it's just Mother Nature working things out, is the way she put it. So
I'm going to ask a really tough question, and you can decide not to answer it if you don't want to. So the technology is there now. Let's say that Heather was born 2 years from now with the same group of problems that she was born with 34 years ago. And in the newborn screen, her genome was sequenced, and it was found that she had this mutation. She was homozygous for this mutation, and that she had Miller syndrome, and that you and your husband were carriers, and you got pregnant again. And now, you know, you got pregnant with Logan, just as you did 3 years later. And testing now is available to tell whether Logan, the next pregnancy, is going to be affected with this condition. Would you have the testing? And if you did have the testing and found out that Logan was affected, what would you do?
Ooh. Actually, soon after I was divorced, I was dating someone. And we became intimate. And I was afraid I might be pregnant. And I was a single mom, 2 disabled children, and I wasn't pregnant. So I never will know for sure, but I decided if I were pregnant, I would have an abortion. There is no way that I would bring a child into this world with all these problems. And knowing what I know now, the suffering that Heather and Logan go through every day, never would I want to bring a person into this world to go through that kind of suffering, knowingly. Would I do it? I don't know. Luckily, I'm not in that position to find out if I really would, but not being in that position, that's my answer.
Thanks. That's, it's very hard, but the fact is that technology has changed to the point now where that is going to really become a serious decision that people are going to have to make. So it's an interesting...
I wouldn't tell anybody about it, though.
Uh-huh.
I wouldn't tell anybody that I did it if I did it, because I, like you, we all worry about judgments from other people. And one thing I've learned, being Heather and Logan's mother, the most important thing is compassion. And when you have true compassion, you're not so quick to judge. Your humanness wants to judge, but your love and your compassion comes and overrides that, and you say, I don't know what they've been through. I don't know what's making them make this decision. And let it go.
Well, thank you. There's so many things I want to ask you. Maybe people will ask it in the audience, but we're going to have to stop just because we're running out of time. But I want to ask you at the end, is there anything that you want to tell these guys? This is a group of first-year medical students who are looking at their career in medicine. Is there anything, as the mother of 2 kids with a rare genetic disorder, that you want them to know to carry with them through their careers?
Well, I'll say what Heather has said too, and that is, remember, your patients are people, and they have feelings. They're not a syndrome. They're not a symptom. They're people. Come from your heart.
Thank
That's
you.
the most important thing.
Thank you so much for coming and for talking to the students and for being you. Do you guys have any questions you'd like to ask?
Obviously, I'm not afraid to answer questions. If I can answer that last question. Come on, you guys, don't be shy.
Yes? It sure was. So I had a public health nurse come in every month, and she would evaluate Heather based on what she was doing, and she was on or above her age level in everything that she was doing. Except for one thing, and I don't know if it's autism related, but she didn't have the natural reflex to reach. So you could hold her by her feet and take her toward the floor, and she wouldn't reach for the floor. So we worked on that, so I knew right away. I mean, not right away, but I could see that she was doing things as well. She was learning to talk and, doing the things that babies do. You had a question?
Yeah. What's their education like?
So they went to regular school. That's a very common question. And I would never wish that they would have a hearing loss, but because they have a hearing loss, they had a hearing specialist that was basically their tutor, literally from kindergarten till they graduated from high school. So she worked with them they rarely had homework because they did it in class with her. And so that helped a lot. And I stayed in the same neighborhood intentionally because I wanted them to be with the same kids that got used to them. I never would have wanted to move to another neighborhood and expose them to that. Yep.
Obviously, with the problems with their legs and things like that, it'd be hard for them to learn to crawl and walk and things like that. So I was wondering if you could tell us a little bit about their development.
Yeah, there's a little video. They didn't show the whole thing on that news story, but Heather and Logan scooted around on their bottom, and they could go pretty fast too. They just used their legs, scooting around. And when they got excited, you know how a dog runs around in circles? Logan would use his heels, digging him into the floor, and go around in circles on his bottom. So that's how they got around. Now Logan, he wasn't walking at the time that he should have been, and we discovered that he had some really tight ligaments on the side of his knees and the side of his hips. So once those ligaments were clipped a little bit, then he was able to walk. And by the way, as an adult, they have trouble. They can walk, but they pronate severely, and they have a tendon or a ligament that's supposed to be attached behind the ankle bone that's attached in front of the ankle bone. So they are more limited, and they probably should have surgery, but whenever it's a surgery that isn't commonly performed, we kind of wait until it's a must. Yep. Yeah. Mm-hmm. Yeah. Yeah. You know, the geneticist, every time I ran into him, I'd heard that it was hard on marriage, and he'd go, "How's Heather and Logan?" I'd say, "Fine." He'd go, "How's your marriage?" And I resented him for asking me how my marriage was, implying that my marriage wouldn't survive just fine. But I was probably in a little denial about that as well. And I wasn't real open to counseling, you know. They'd suggest counseling, and I was pretty defensive because my family was dysfunctional. I know everyone's is at a certain degree, but so we had some counseling that it just wasn't a good experience. So, you know, I didn't, and they always say the number one problem is communication. So communication and encouraging communication. And, you know, a big thing that I'm still learning is it's so important to feel your feelings. If you feel disappointment, feel it, and then it'll go away. But if you don't feel it and you block it off, it won't go away. It just comes out in other places. So, you know, trying to get couples to communicate with each other or go to a therapist to help communication, read books, that's my favorite, communication, and talk about it. Terry and I never talked about how do we feel about people staring at our children? How do we feel about having a child with these disabilities? We never discussed how we felt about it. It's strange, but we didn't. I'm glad you asked that, because the only way I've ever, this was great, doing a question and answer. I wasn't nervous at all. Usually I just stand up and
I was a wreck.
I just stand up for 25 minutes and I basically tell you my story. And I do say, with Heather and Logan sitting there, I didn't want her. And then I usually say, for those of you squirming in your seats right now, don't worry. Heather has heard this before. She knows it was an automatic knee-jerk reaction of denial. She's experienced that kind of reaction, and she's experienced 34 years of amazing love. And so she understands, and there aren't any, plus she's autistic. I mean, maybe someone who isn't autistic, you know, even before she understood it, she probably would have just, you know, but, so you don't, and it's in my book. By the way, Heather's a writer. Heather has written beautiful passages in the book. And Logan's an artist, and you can see his art online. I actually brought a portfolio of some of his art up there in my suitcase. So anyway, they understand. They know I love them.
I was just wondering how your faith played into
That's a good question. So Mormonism is all I knew. All my friends were Mormon. Everybody I knew was Mormon. Then after my divorce, and I started to meet people who weren't Mormon and go, these are okay people. I mean, they're nice. I mean, and so I started to think outside the box, and my experience didn't fit in the box. And so I'd go to church, and when it's like, okay, today we're going to learn how to clean out our cupboards and organize our house. And I was just thinking, And they had a song that was Families Are Forever, Together Forever. And it's a beautiful song, but my family is not together. And it just, my faith was challenged to the max. And if we're here to have our faith challenged, I failed the test because I lost it all. I didn't even believe in any kind of higher power. And it was okay. I just lived my... And then I had an eating disorder for 3 years, which you'll read about in my book as a reaction to my life falling apart, my marriage falling apart, and denying that anything was happening. Comes out in other places if you don't deal with it. And that's when I learned how to believe in a power greater than myself, even if I had to learn how to believe that the group together is an energy greater than me. One other person, a friend, is an energy greater than me. So I started from baby steps into really, truly believing in, depending in a power greater than me, but I have no idea what that power is. But I'm appreciative for all religions. And I take little bits and pieces from everyone's and add it to my own personal belief that can help me through all my challenges.
Any other questions? I want to tell you guys, you covered the questions that I wanted to ask but ran out of time. So thank you for doing that.
Okay, really quick, I just want to say there's a couple little doctor parts, okay? So the first doctor I went to was the plastic surgeon for Heather's cleft palate. You've heard of Cold and Clinical? This guy could win the prize. He said, what's her problems? Well, I think it's Treacher Collins. Oh, well, that's not her only problems. Did you and the dad do drugs? Now, we'd already been asked, about those kinds of things, but in a different way. So when I left his office, I was in tears. I went to my car and I said, that man is not touching my baby. And I went home and I called the office and I scheduled the surgery with his associate. So Heather had the surgery, 6 a.m., I'm there to meet the doctor, and in walks Mr. Wonderful. Well, he just happened to be the one that was checking on Heather every morning, and I learned to get to know him in a different context. And he ended up being one of my favorite doctors, and I learned to appreciate his cynical side and his funny sense of humor. So after Logan was born, I couldn't wait to go show him Logan, really. I couldn't wait to hear what he was going to say. So I walk in, and he walks in, and he said, wow, did you get fixed? And I said, no, but their dad's getting fixed. And he said, well, maybe both of you should get fixed. And then he said, he opened up the door and he put his head out and he said, come here, you guys, you got to come see this. It's like two peas out of the same pod. But I could appreciate him by then. And he was amazing, and he did amazing plastic surgery on Heather's eyes and on their cleft palates. So then another experience later on that's Logan's story, but he's not here to tell it. So they needed to find a new doctor, and Heather just loved this nurse practitioner that just wanted to scoop him up in her arms and just watch over him and take care of him, but she was also very fascinated with the syndrome. Now, Heather liked that about her because it made her feel really important that she was so fascinated with the syndrome. Logan, on the other hand, remember, he's in denial and thinking he's normal, right? So he goes in and she's calling in her colleagues to talk to him, and she said, did you know cartoon characters have 3 fingers and 3 toes? Now, that did not go over big with Logan. So, and he tells it so funny, I wish he could be here. And there's one other story Logan told last year. I just had tears rolling down my face. So he's telling the medical students, okay, I walk into a coffee shop, I go to buy a chai tea or something, and I have to get in my pockets. And of course, he's got short arms and he's 6'1". And so he's bending in his jean pockets, which are kind of tight, and he's looking for the change. And of course, there's people coming in and the line's starting to grow behind him, and he's getting kind of nervous because he's trying to find his change. And so he looks up and he says, you just hope they don't think you're doing something else. He has a great sense of humor. So, and Heather and Logan will welcome emails from you guys. If ever you have other questions, all 3 of us, we welcome emails. We'll answer your questions, whatever we didn't have time for today.
Again, thank you, Debbie, for coming. And thank you all for coming also. And again, congratulations on finishing Molecular and Cellular Foundations of Medicine.
You announce the book?
Yeah. And
My book!
Debbie has copies of the book.
I actually have signed copies of the book in the back, and your Barnes & Noble store ordered some. The reason that I wanted to bring my signed copies is just because I self-published my book because I didn't want to wait for a publisher because Heather and Logan could die before I get a publisher. And seriously, I really wanted them alive when this book came out. So it is kind of challenging to mark up my book, so even Barnes & Noble won't carry it on their shelf. You have to walk into a bookstore and order it, or you can get it online with Amazon, or you can get it online with Barnes & Noble. I have an audio book that I'm working on getting a venue right now. I think it'll come out in Learn Out Loud and whatever other venues. There's ebooks for Nook, soon for Apple. We're working on that one, and there's one on Amazon. And then I have copies in the back, and the Barnes & Noble's offering 20% off, which makes it $16, and I will as well. And so just wanted to let you know. Thank you.
Thank you.